I'm Dr. Stan Yeatts with Stork Advisor. Today, we're diving into a topic that's close to my heart and crucial for many of you watching. It's endometriosis and its impact on fertility. As an OB-GYN physician with over 30 years of experience, I've seen firsthand the challenges that this condition presents. But I've also witnessed incredible triumphs, and that's what I want to share with you today. Let's start with a surprising statistic. Did you know that endometriosis affects up to 10% of women of reproductive age? That's millions of women worldwide, many of whom are silently struggling with the symptoms, including fertility issues. But here's the good news. There's hope on the horizon. Medical advancement opening new doors, and I'm here to guide you through them. Now, when I started my practice, endometriosis was often misunderstood and frequently underdiagnosed. I remember meeting a young woman I'll call Angela. She and her husband had been trying to conceive for years. She was in pain, frustrated, and losing hope. Her story is not unique. It's one I've heard countless times over my career. Endometriosis is like an invisible enemy. It occurs when tissue similar to the uterine lining grows outside of the uterus. This can lead to inflammation with pain. Sometimes scarring in the pelvis may occur. Then fertility challenges are possible. The statistics are sobering. Women with endometriosis have a monthly pregnancy rate of only 2 to 10% compared to 15 to 20% for those without the condition. But I want you to know that these numbers don't define your journey. I've seen women overcome incredible odds, and that's the message of hope I want to share today. There are treatment options available and success stories that will inspire you. Let's dig a little deeper into how endometriosis affects fertility. It's not just about the pain, though that's certainly a significant aspect. Endometriosis can impact fertility in several ways. First, it can cause inflammation and scarring in the reproductive organs. It may block fallopian tubes, preventing eggs from meeting the sperm with conception. It can affect the quality of ovulation and the receptivity of the uterus. These factors contribute to why at least 25% of women with infertility are diagnosed with endometriosis. It's a significant number, but it's not the end of the story. I remember working with Emma, a patient who had been struggling with severe endometriosis for years. She came to me feeling defeated, thinking her dreams of motherhood were slipping away. But through a combination of surgical intervention and medical treatment, Emma was able to get pregnant and is now a proud mother. Her story is just one of many that fuel my passion to encourage others. The medical community has made incredible strides in understanding and treating endometriosis-related infertility. From advanced laparoscopic surgeries to innovative fertility treatments, we have more tools than ever to help women conceive. In fact, with proper treatment, many women with endometriosis go on to have healthy pregnancies and beautiful babies. Now, I know that facing fertility challenges can be emotionally overwhelming. Sometimes women receive medical care with very little encouragement or even pessimism. I've sat with countless women and couples who shared their fears and frustrations, but I've also shared their joy when treatments succeed. No one knows the future and has all the answers to life's questions. My goal has been to provide medical care with realistic and compassionate support. So let's talk about some of the advanced treatment options available. Laparoscopic surgery is something to consider. It's a minimally invasive procedure that can diagnose and possibly treat endometriosis. I've lost count of how many of these surgeries I've performed. The results can truly be life-changing. Medical treatments are available. These various therapies can help manage the symptoms of endometriosis. Options include temporary use of oral contraceptives as a means to stabilize hormonal levels and symptoms. There are specific medications that are FDA approved for endometriosis treatment, with brand names of Orilissa and Lupron. These medications block the estrogen in the woman's body temporarily to prevent stimulation of endometriosis implants. Reproductive medicine technology is available for many women with severe cases of endometriosis. Intrauterine insemination and in vitro fertilization are options when appropriate. The success rates are encouraging, especially for younger women. Egg freezing can preserve fertility for future family planning, which can be crucial for women with progressive endometriosis. I remember Lisa, another patient who struggled with symptoms of pain and abnormal bleeding with infertility. She ultimately was diagnosed with surgical treatment of endometriosis. With the help of advanced reproductive technology, Lisa is the mother of a beautiful little girl. Her perseverance and the improvements in reproductive medicine made her dream a reality. And what's crucial to understand is that each woman's journey is unique. That's why I advocate a personalized care approach. We consider your specific symptoms, your fertility goals, and the overall health to create a treatment plan that's right for you. Now, you might be wondering, what can I do next? Here are some actionable steps you can take. First, schedule a consultation. If you're experiencing symptoms of endometriosis or having trouble conceiving, don't wait. Early diagnosis and treatment can make a significant difference in your fertility journey. Explore treatment options. Educate yourself about the various treatment options available. Knowledge is power, and understanding your choices can help you make informed decisions about your care. Stay informed. Medical professionals can have a hard time keeping up with the latest advancements in endometriosis and fertility treatments. You can research the subject with reputable sources or follow trusted healthcare providers on social media. Don't forget to join support groups. Connecting with others who understand your experience can be incredibly empowering. There are many online and in-person support groups for women with endometriosis. Remember, you're not alone in this journey. As a doctor who's dedicated his career to women's health, I've seen the incredible resilience of the human spirit. I've witnessed the joy of women who thought they'd never conceive, ultimately holding their baby. Endometriosis may be a challenge, but it doesn't have to be the end of your fertility story. With the right care, support, and determination, many women overcome this condition to achieve the dreams of motherhood. I invite you to take that courageous step today, whether it's scheduling a consultation, joining a support group, or simply learning more about your options. You're moving toward the path of parenthood. Thank you for allowing me to be a part of your journey. Remember, at Stork Advisor, we're here to help. Please like or subscribe to our channel for more expert advice on women's health and fertility. Until next time, this is Dr. Stan Yeatts wishing you health, hope, and happiness on your fertility journey. Please join me again.